So where do I come in? Where's my page?
This is my note, so let's move this.
Okay, we don't. I'll put this here.
There you are.
Okay, so this is where I will start.
Yep. Yep, that's where it is. Yep.
Not from the previous page? No.
Nope, that's me.
Okay, there. Sure. Okay, so I'll start here. Okay, good. Whenever you call me.
A lot of great comments.
Good. No, it went well, and there was more crowd here
Yep.
today.
Well, I counted 95 at one point. I bet you there's probably more than that.
Yeah.
So great turnout.
Yeah, and some will eat some.
Yep. So we want to make sure we have major, not necessarily for this part, but for the next part. Yeah, they're going to have to figure that all out. We're good for a little bit yet. Ladies and gentlemen, first of all, I just want to say to you the program today does not have any financial support or influence from drug industry or OHIP. All the speakers have volunteered their time today. So ladies and gentlemen, what about a round of applause for all the speakers today? Other than Dr. Phil, because I won't be eating steak with a clear conscience tonight, but great job. We'd like now to begin one of the most important parts of the day, the award presentation to Durham Region's most outstanding cardiac nurse, ER nurse, and paramedic of the year. Today we have Dr. Anthony Stone, the Chief of Staff at Lake Ridge Health, and Mr. Matt Anderson, the CEO for Lake Ridge Health Corporation, here to present the awards to this year's recipients. I'd like to call upon now Dr. Bargava to introduce our recipients for the Most Outstanding Cardiac Nurse and Emergency Awards for 2018.
Well, thank you, Fred. In case I forget later, you have done an outstanding job as a speaker initially, as a patient and a moderator. So thank you. And a lot of people said, well, you did very well. So this is the 5th year of the... Okay, don't lean on anything. Okay. This does not have any brakes here, or brakes have failed. This is the 5th year we are doing this Most Outstanding Nurse and the Paramedic Award. Mind you, these lecture session, public education forums, we have been doing for more than 15, 18 years. We have lost count, but we started this about 5 years back. So the Most Outstanding Cardiac Nurse Award has a special element, as the winner is selected after a vote amongst their own peers, which is a huge honor. This is a true test of a deserving recipient. The persons who are getting the awards here are not chosen by me or by my chief of staff or my CEO of our hospital. These are chosen by their own peers. They voted them as the people they look up to. They are just outstanding in what they do. So this year's Heart Care Most Outstanding Cardiac Nurse Award will be presented to Rachel Howie. And Rachel is somewhere here. And so to tell you something about Rachel, she received her Bachelor of Science in Nursing with honors from UOIT in 2012. She completed her Advanced Coronary Care course at Durham College in 2013 and 15. She participates in Advanced Coronary Life Support training annually and has worked at Lake Ridge Health for the past 6 years. In 2013, she also worked at Ontario Shores for Mental Health Sciences. Not only she is a qualified cardiac nurse, she is caring and dedicated to all her patients. To top it all off, she also has given back to the community by volunteering for Canadian blood services in the Ontario Network for Prevention of Elder Abuse for several years. She will be completing 5 years of marriage this November to her husband, Jesse Howe, who is here. I thought she was, and her father is here too. I thought he was Gandhi Howe, but he's not, you know. And she's here with her she's also a first-time mom to a baby, Judy Howe, who was born on March 12th, and she's here to see her mother getting this award. She would like to share this award with all of her powerful and intelligent colleagues on C7, which is the cardiology ward, and in the ACU, the acute coronary unit, and she's honored to work with such amazing men and women. So it is my privilege to present Rachel Howe as the most outstanding cardiac nurse of 2018. Congratulations. Okay. Are we doing all right? That's my chauffeur. She told me, Dad, you do this, you move in, and you move out, don't stand in there. So anyway. So congratulations again to Rachel. The next award is for the most outstanding critical care nurse, and it is being presented to an individual who has shown exemplary work ethic, care, and dedication to their role in the critical care unit. Again, in this case, the awardee is selected through a vote of their peers. This year, I'm honored to present to you this year's most outstanding critical care award recipient. This year's award recipient is very knowledgeable, a great team player, and very helpful in the work environment. She's very kind and allows others to feel comfortable in a shared environment. And this person is Irene Bonner. She has been a critical care nurse for a long time and is soon going to retire. When we got the announcement, I phoned her. She said, Dr. B, that's what I'm called, I have 8 shifts left. How many are left, Irene, now? 3 left, she's counting. But that's the crowning glory of her career. So Irene leads by example, has superior nursing and medical knowledge, and always is happy to answer any questions, cardiac or otherwise. Her colleagues feel that she is a pleasure to work with. She's a very caring and compassionate nurse that emanates professionalism and high standards of care at all times. Even on her days off, she devotes her time to Trillium Gift of Life, which has become a passion of hers. Irene is a truly inspirational member of our healthcare team. And just so that you know, I think this is the day or the week for this organ donation thing. Irene has always been an exceptional nurse. She takes time to mentor new staff, answer questions, is a positive team member, and takes amazing care of her patients. Truly a role model for her staff to follow. What Irene has brought to the critical care is an example of nursing beyond just the basic care. It encompasses the patient, their loved ones, co-workers, and exemplifies the role of a nurse. Irene is a true gift for the nursing profession. She definitely leads by example and will greatly be missed by many staff whom she has mentored. We know that they will carry on her legend. I'm proud to present you with the most outstanding Critical Care Nurse Award. Congratulations, Irene and Irene Bonner. Oh, I was wondering. Well, congratulations again to Irene. So we come to the next one. Our most outstanding emergency room or emergency department nurse award. This is a new to our roster of awards. When we started 5 years back, when the emergency room nurses heard about this award, she said, Dr. B, are we chopped liver? How come we look after your patients and we do not get recognized? I said, yes, this has been mentioned and this will be corrected. And we were going to do this last year. And in fact, our chief of staff, when he came here last year, he said, what about that was 2 years back, I think. So I said, yes, it is being done. But last year we just couldn't get our act together. But here we are. As I always say, we have these first responders and we'll be honoring one of them. These nurses are second responders. We doctors are the third responders because when everything is done, then they bring to us, And these are the people, and I always say every year, especially the paramedics, well, I'm saying it before time, but these are the people who go in the worst condition, save you, and then bring you to us. If they didn't do what they did and give it to our second responders, Tony, you and me have no role here. Anyway, so our most outstanding ER nurse award is new to our roster, as I said, and this individual who has also shown exemplary work ethic, care and dedication to the role in the emergency department at Lake Ridge Health. When working in the emergency department, it is such a fast-paced environment. One always had to be ready for whatever challenges come their way. Again, in this case, the awardees are selected through a vote of their peers. I'm honored to present to you this year's most outstanding ER Nurse Award recipient, Vicky Wenzel. Vicky was nominated by her co-workers as the emergency department's outstanding cardiac nurse. She is known to be passionate about her patients and is always striving to understand what is going on from a clinical process. She has a great understanding of cardiac rhythms, their meaning, and how to identify them. She also understands what they mean from a clinical treatment sense. She's always looking to expand her knowledge by either researching more information or, quote-unquote, picking the brain of an expert in the field. Furthermore, she is always willing and very happy to share her knowledge with her co-workers, a caring and dedicated nurse who is well deserving of this award. Vicky, we present you with our most outstanding critical care nurse award. Oh, the emergency room nurse. Okay. Sometimes these nurses have to go and work elsewhere in the department as well, in the hospital. Well, congratulations to our wonderful and dedicated nurses. We thank you for your service that you do. You help us physicians do what we have to do and, of course, look after the whole community. Now, it is my honor to present to you our most outstanding paramedic of 2018. For the last 4 years, it has always been a man. But this year, it is Lindsay. She became interested in paramedics while working in a summer camp and witnessed one of her co-workers get injured. After this, Lindsay realized that her demeanor and caring nature would be perfect for a career in paramedic services. With this in mind, Lindsay went back to school to become a paramedic in 2006. And subsequently began her employment with the Region of Durham Paramedic Services in 2008. In 2012, Lindsay had an opportunity to enhance her skills and went to Durham College and graduated from the Advanced Care Paramedic program. Lindsay's passion is teaching our next generation of paramedics. Lindsay has mentored numerous students through their preceptorship on ambulance training. Also, Lindsay works part-time as a paramedic instructor at the Durham College, where she puts her degree in adult education to good use. Lindsay lives in the area with her husband, who is also a paramedic in the GTA. Lindsay Hansen is a highly deserving recipient of this year's HeartCare Most Outstanding Paramedic Award. Congratulations, Lindsay, and thank you for your service. And thank you for your service to our community. More picture. More picture. Thank you. Okay. I think I'm going to hand you.
Yes.
Oh, and are we going to have our two people say something?
Ladies and gentlemen, as I said earlier, and based on the accomplishments of these individuals, we just recognize you're in excellent care and control by Lake Ridge Hospital. So, ladies and gentlemen, you're very fortunate to have a hospital system that cares. Again, congratulations to all of our winners. I'd like to call upon Mr. Jim Ellis from the Faith United Church to bless the award recipients.
Let us bow for prayer. Holy One, in recent days we've all been very much aware of the reality that we are all sisters and brothers of one human family on this earthly home, coming to help each other in times of trouble and tragedy, comforting each other in sorrow and grief. We watched as responders like Rachel, Vicki, Lindsay, and Irene became your arms of comfort and healing presence to hurting and dying people on the streets of Toronto and in the hospitals to which they were transported. And we were deeply moved to hear and witness women and men of many faith groups, irrespective of religious persuasion, responding to your call to all of us to, first of all, love, love, love. So we pause this afternoon to say a special thank you to 4 outstanding caregivers, Rachel Howe, Vicki Vensel, Lindsay Hansen, and Irene Bonner. Their work is rewarding and costly at the same time. May they experience your gracious presence, blessing, and renewal of their inner resources each day as they continue to be sources of healing and hope to others in the days ahead. And may each of us be more aware of the demands on them and be grateful for them and their colleagues, and appreciative of the many ways in which they are sources of your presence in some of the most difficult circumstances in our lives. Amen.
Again, Congratulations to our award recipients. I would also like to thank Mr. Ellis for his thoughtful blessings and the Faith United Church for the lovely food they had prepared. Our next speaker to kickstart our afternoon program is a dentist, Dr. Sanjay Gandhi. Now, he's not a Bhargavian name, but he is Dr. Bhargava's son-in-law. And I'm sure he's here to remind us to brush our teeth since we just had lunch. Now, Dr. Gandhi has been in the private practice for 18 years and currently owns his own dental clinic in Whitby. He was born in Toronto, raised in Whitby, attending Dr. Robert Thornton and Henry Street High School. Dr. Gandhi completed his undergraduate training at the University of Toronto and then went on to receive his Doctor of Dental Surgery degree from the University of Western Ontario. He practices all aspects of general and family dentistry with a specific interest in cosmetic dentistry, root canals. Dr. Gandhi has received hospital training from Mount Sinai Hospital in Toronto and is currently an active member of the international team of implantology. I think we've all heard that the mouth is the gateway to the rest of the body. Today, Dr. Gandhi will be educating us on why dental care is a prescription for a healthy heart. Ladies and gentlemen, Dr. Gandhi. Now, you know I have to say this, you know that, right? You can see that he's moving very slowly today. Apparently, so the story goes, I may not have it 100% accurate, but his father-in-law asked him to help him to move something. You know how father-in-laws can be. And it was bigger than the task assigned. And unfortunately, for our pleasure today, he is wearing shoes because he has a broken toe. But he has really nice socks on, so if he takes his shoe off because of the pain, you know, don't worry about it. And he is a darn good golfer, too.
Well, thank you. Is this on? Is it on? Everybody hear me? It is? Okay, good. Okay, so thanks for coming today. I'm glad to see that there are some people that hung out to listen to my presentation. I'm probably one of those, 2 people that you hope that you never have to either call or see in your life, right? See? Thank you. One is your lawyer, and the second is the dentist, right? If we never oh, sorry, I had no idea. Had I known, I would have rewritten my script. Anyway, so my name is Dr. Sanjay Gandhi. I have quite a few things that I want to kind of get through today. I have a little bit of a challenging task because I have to talk about, I got to talk about your mouth, I got to talk about your heart, and then we're going to talk about a few things in between as well. So I apologize if I go through a little quickly because I know we're on strict timelines, but I will be around afterwards if anybody has any specific questions, and hopefully I don't wreck my microphone. Okay, hopefully this works. Okay, perfect. So this is my practice here at Meadow Glen Dental Care. I practice in Whitby, and I've been practicing for almost 18 years. I practice all aspects of general dentistry, so if there's any questions that anybody has, hopefully I can answer them. So let's go through what we're going to talk about today. So list of objectives today. So we're going to talk about periodontal disease or gum disease. We're going to make sure that everybody understands some of the terms. We'll start off a little bit basic, just so that everybody can sort of, we'll make sure that everybody's on the same page. We're going to talk about risk factors. So that's something that we've been hearing about a lot today. We had Dr. Phil talking about it, we had Dr. Bazia talking about it, and all the way down the line, we're talking about risk factors and what can we do to help improve things and try to prevent things from happening. We're going to talk about the connection between periodontal disease and heart disease. And then we're going to switch gears a little bit, and we're going to talk about inflammation and diabetes. We've already heard a couple of people talking about diabetes as well. And then we'll talk about treating periodontal disease, and actually something else we'll talk about this year is options for missing teeth. So I have a question for everybody is, does everybody know that there's a connection between your mouth and your heart? Or is this something new for people? Does everybody know? Who knows about it? Put up your hand. Okay, good. So a good number of people know. Because I think a lot of people were probably surprised to hear about the connection between the eye and the heart, and maybe people forgot about something that's in between both of those. But, there's definitely a connection there, and we'll explore that today. Okay, so a couple of facts. How many people in the adult population do you think has gum disease? Throw out a number as a percentage. What do you think? 20%? 60? 90? 70? So it's interesting because when I started giving this talk, a number of years back, as soon as I married into this family that likes to talk to people, the numbers used to be about 70% or 80%. Now the numbers are actually slowly starting to come down a little bit, but it's still 50%. So 50% of the American adults have gum disease. So it's nice to see that things are getting better, but I mean, if you think about 50%, I mean, it's, obviously half the people that are sitting in the room, right? So it is something that is still very common. I'm going to throw up a couple more facts here, and hopefully we'll, get some people's attention, and, hopefully we'll prevent people from sleeping. So women with gum disease, 7 to 8 times more likely to deliver a premature, low birth weight baby. This is something that a lot of people are very, very surprised at. But I mean, the connections, they go quite deep. Studies of the fatty deposits which are lodged within the carotid arteries, which we've heard some of the people talking about, in stroke sufferers, 70% of those deposits contain bacteria, and 40% of those bacteria come from the mouth. Okay, so a lot of the things, and you've heard other people talking about this as well, we're always getting our information from the studies, from literature, because that's what we have to go by. We have to base our treatment and our protocols based on what the science is telling us. People with gum disease, twice as likely to die from heart disease, 3 times more likely to die from stroke. Okay, this numbers that are put out by the Mayo Clinic. So pretty big. This is an interesting one, actually, and I'm not sure how many people realize this, but you can actually pass gum disease on. So the transmission rate of a certain bacteria, I will talk about this later, of this bacteria from parent to child, 32%, and between married couples is 36%. So we're talking about kissing, sharing foods, drinking from the same straw, that sort of thing. So you can actually pass this on. So it's not that taking care of this is helpful for you, but it's also helpful for your spouse, your child, or whatever. So now this last one that I'm going to put up, I found and I thought was quite staggering. So diabetes and bleeding gums, if you have both of those together, increases your risk of death by 400 to 700%. How many people in the room are diabetic? Okay, that's good, not too many. Make sure you're going to the dentist. This is really important. Okay, and we're going to talk about diabetes a little bit more, a little later on. Okay, so I want to talk about a couple of basic definitions just to make sure that everybody is on the same page. So plaque. Plaque is defined as the accumulation of loose food debris after we've had something to eat. We were provided a nice nutrition break here, so there's undoubtedly some food that's kind of left over. If it sits too long, bacteria will adhere to that. That's what we call plaque. Okay? After the plaque has been there for a while, it hardens, and then it's referred to as calculus or tartar. That's what we're scraping off when you come to see us. Okay, we're using stainless steel instruments to get this stuff off your teeth. You're not going to get it off. Doesn't matter what kind of toothbrush you use. You can use a toothpick. It's not going to work. You're not going to get it off your teeth. Okay, you can't avoid us. Gingivitis. Gingivitis is when we have infection and inflammation, which is just limited to the gum tissue. Once the infection progresses a little bit deeper and it gets into the bone, it's referred to as periodontal disease. Okay. And we'll explore all these things a little bit more if you're getting lost. Now, this is a term that you're going to hear me talking a lot about. We're going to talk about something called a pocket. Now, when you go to the dentist or to your hygienist, we want to make sure that they're checking your pockets. We're not looking for loose change. It doesn't really matter. That's okay. What we're looking for is we're measuring the space, the natural space that you have around your teeth. And I'll show you some pictures just so that it makes a little bit more sense. But this is the one big thing, and this is how we can measure how much disease there is that's going on. Okay? So, let's talk about periodontal disease. So, this is what we strive for. Pink is king. That's what we're after. Okay? So, we want the gums to have a nice pink color. You want all the gum tissue in between the teeth to be what we refer to as knife-edged. We want them to be very sharply defined. They should fill the space between the teeth. Okay? There should be no bleeding, and your pockets are within 2 to 3 millimeters. Okay? So, this is what we're all after. Now, I just put this up for sake on the x-ray. This is the bone in here in between the teeth, the kind of spongy-looking material. We want it to be very flat, very high up on the teeth. Okay? So, gingivitis. Your gums start to bleed easily when you brush and floss. I can't tell you how many people come in and I meet them for the first time and they'll be like, I'll ask them, I'll be like, do you have any concerns for your teeth? Well, my teeth, my gums bleed a little bit when I brush, but that's normal. It's not normal. When you brush your hair doesn't bleed. Right? So why is it normal that, if you brush your teeth and your gums bleed? That's not normal. That's an indication that there is already infection starting to build up. It's very low grade, but your body's trying to tell you there's a problem. Okay? What it's trying to do is flush that bacteria out of your system. Okay? So gums are sensitive, may be starting to get a little bit of bad breath. Your pockets are still normal. You start to get a little bit of redness. Can we appreciate how there's a little bit of redness around the gums there, in between the teeth? Doesn't look quite as nice and pink and quite as sharp as it did in the other image. That's some of the changes that we start to see. Now, as we start to get a little bit further on, now when we get into periodontitis, so the infection is starting to get into the bone, that's when we notice that the pockets are starting to change. So normally, that measurement that we take is 2 to 3 millimeters. Now we're getting into that 3 to 4 millimeter range. It doesn't sound like much, but when you're talking about below the gum line, now we're starting to get down deeper. Okay? Definitely have some bad breath. And the gum tissue may pull away from the teeth. You can see definitely some more redness. Can you see how the gum tissues are starting to pull away? They're starting to get a little lower. Some people refer to it as getting long in the tooth. Right? Heard that term before? So that's what starts to happen. So like I say, when we're measuring a pocket, what we're doing is we're measuring from the top of the gum to where the gum attaches to the tooth. Okay, so now we're getting into that 3 to 4 millimeter range. I'm glad that we've all eaten, everybody's good. So I'm not going to lose anybody today. Now we're getting into moderate. Definitely bad breath. We can have some visible abscesses. Pockets now between 4 to 6 millimeters. This is a patient who's still part of my practice, and when she walked in, I said, what's your chief complaint? She goes, well, I don't like the look of my top 2 front teeth. Can you fix those for me? I said, well, what about what's going on down here? Is that okay? The problem is a lot of people don't have any pain or any issues when it comes to gum disease, which is why they just don't really think that there's anything that's going on, right? But obviously everybody can see this. Definitely that's a problem, right? So we got to fix that. All right, so now we're going to go one step further. Oh, I'm going to show you an x-ray actually. So now what we can see, can you see the difference in the bone now? See how it's starting to shrink and it's starting to move down on the teeth? Okay, now when we get into the next category, okay, again, another patient of mine walks into the practice. Definitely bad breath. When people get to this stage or even the moderate stage, I can actually tell when people walk in the door if we're dealing with a situation like this. It actually does kind of smell like rotting flesh. In fact, a lot of times when we go to the restaurant and stuff, Rachel will actually, now she'll know too, the waiter will come over and she's like, was that GD? Is that gum disease? And I said, yeah, that's what that was. And I'll go stand over here. But you can tell, like when it gets to that point, you can smell it, okay? And now, when we're looking on an x-ray, this is now what we start to see. There's no bone left. When I had to do this extraction, I actually just grabbed it with my fingers, plucked it out. I felt bad charging the person for it. I was like, when somebody comes to me and they say, well, my teeth are moving when I breathe. How did we get to this point, right? That's what everybody wants to know. How did I get here? Okay, so let's talk about what the process is. How do we get to this point? So the plaque that we talked about, it'll form within 24 to 48 hours. That's why we tell you to brush every day, okay? Twice a day. You got to do it twice a day because that's what you're getting off with your toothbrush is the plaque. Bacteria colonize on the plaque. Plaque and calculus start above the gum line and make their way down. Okay, we start with gingivitis. We go down to periodontal disease as we get down into the bone. Okay? What happens is when we have the infection inflammation, we get release of inflammatory media, natural chemicals that the body will release to try to combat these things, and we end up with loss of bone and tissue around the teeth. Okay? Now, the studies will show that you will have full bacterial colonization below the level of the gum within 90 days. So, has anyone ever heard that your dentist tells you to go to get your teeth cleaned every 3 months? We just think we're trying to make more money, right? But that's what the studies will show. Okay, within 90 days, and you're going to hear this number again when we talk about diabetes, so remember this. Within 90 days, you'll have full bacterial colonization below the gum line. Okay, and then the next thing is this one's actually interesting too. So the amount of plaque in your mouth will double every month. So a lot of people, we get busy, we get lost in our own lives. I can't go this month, I'm going to go next month. Right? Next month, the weather's too nice, I'm going to go next month. Right? Oh, we'll wait till September, now I got to go to the cottage. So every month, your bacterial load is doubling every month. Okay? So now, studies are actually saying, don't tell people 90 days. Tell them we want to see them every 12 weeks. Right? 12 weeks, 16 weeks. Now we're talking weeks because now we're starting to recognize how much difference it makes when time goes by. This is an x-ray that I put up here to show you. So look at the time difference here. What do you got? A year and a half. We got 4 front teeth here. Look at the bone levels. Look where they are now. This poor patient within a year and a half lost their upper 4 front teeth for something that's completely preventable. Okay? So risk factors. Here's what we've been talking about all day long. What are the risk factors? Poor oral hygiene. Diabetes is a big one. Smoking. Genetics we'll talk about in a little bit. Age, age is not directly related. Okay, that's a little bit of a misnomer there. The problem with age is as we develop certain medical issues as we're getting older, that will affect your teeth. People will get arthritis in their hands, makes it more difficult to brush, makes it more difficult to floss, makes you more susceptible to disease. Okay, I've got patients in my practice that are 75 years old, have all their teeth. So age is a little bit something that is a little bit different. So I'm going to stop there about teeth stuff. We're going to move over into heart stuff. I know we've got a lot of it today, but I have to go through it very quickly. So cardiovascular disease, it's a class of diseases which involve the heart of the blood vessels. The term that we all hear about, we've already heard it this morning, is atherosclerosis. So atherosclerosis is an inflammatory disease, and it's the primary driver for cardiovascular events. Okay, we've already been hearing a lot about it this morning. Dr. Phil showed a very nice slide actually earlier in terms of the blood vessels and the endothelial lining that's in, so the cells that line those blood vessels. If we have damage to the lining, it makes it easier for stuff to stick. Okay, that's how we get our narrowing of the arteries. Okay? So, now let's talk about risk factors for heart disease. Okay, we've been hearing them, about them all day long, right? Cholesterol, hypertension, diabetes, smoking. It looks like the same list I just had on the other slide, right? It's kind of funny how that works. There's a lot of things that are connected. We've been hearing it all morning long. Okay, and what I keep telling people is we need to start considering periodontal disease as a risk for heart disease. Okay, I have a lot of patients that are being referred to me by the cardiologist now. I have a patient who went for a valve replacement. Cardiologist sends them to me and says, we won't do the surgery until you clean their mouth up. Okay, so we're starting to recognize this strong connection. I have another patient who has non-Hodgkin's lymphoma before he could have stem cell treatment. Same thing, no cavities, no infections, make sure he's clean. Okay, really important to make sure you take care of your mouth because people may not look after the rest of your body for you because they know the infections will travel. One of the things we'll talk about too is there's a situation we can get called infective endocarditis where we can get an infection which develops on the valves in your heart. There are certain conditions which will predispose you, prosthetic heart valves, congenital heart disease. These sort of things will predispose you to developing them. And the reason why they're important is because when you go to the dentist, you will need to take antibiotics before certain treatments so that we don't get that infection. Anything where we anticipate bleeding, cleanings, extractions, that sort of thing, you'll take antibiotics 1 hour before your appointment to make sure you don't get development of the infection in your heart. Okay? So now let's talk about how are we connecting gum disease and heart disease. Okay, so there's 2 mechanisms that are proposed. And in my opinion, it's probably a little bit of both. Nobody really knows if it's one that's more than the other. So the first mechanism is the infection model. So what happens is we have bacteria that get into the bloodstream. They invade those cells that we've been talking about, which line those arteries. And that causes the breakdown in those cells. And then we have inflammation that can develop from there. Okay? So it's the infection, the bacteria, that will break down those cells. So what's the evidence for this? So what they're finding is the studies will show there's elevated levels of that bacteria we talked about earlier that can get passed down between spouses, children, etc. I'm not going to try and pronounce this if somebody else wants to. Go ahead. So what we find is that there are elevated levels of these bacteria in patients that have heart disease. And then the other thing that we find is these are the bacteria. We talked about 40% of the bacteria in those plaques. These are the bacteria that we find in those plaques. The only place that you can find these bacteria are in your mouth. Okay, so that's the link, that's the connection. The second mechanism is inflammation. So what this one is talking about is the inflammation in the body which leads to natural chemicals that get released. That will cause damage to the cells that line those blood vessels. So again, it's the same thing. It's something that's destroying the cells in those blood vessels. It makes it easier for stuff to stick. Okay, that's how you develop the atherosclerosis. So what's the evidence here? A lot of people have heard of this protein. It's a very common protein that even the cardiologists and stuff will look for. C-reactive protein is a protein which gets released. It's natural in our body. It gets released when there's some sort of injury in the body. Okay? So even at high normal levels, it's been shown to be a risk factor. It's a marker that we're looking for when we're talking about heart disease. Okay, I'll have to move along. I just got my notice that I'm running out of time. Now, the more aggressive the gum disease, the higher the levels of this protein. But the other thing is interesting is once you treat that gum disease, we notice a decrease in the level of this protein. Okay, so that's where your connection becomes between your mouth and your heart. Okay, now we're going to talk about diabetes for a couple of minutes. Diabetes rates, we've already heard about this. It's rising. It's going up fast. The rates have doubled in the past decade. Okay, 29 million people in the U.S. have diabetes. More than we heard this term earlier. I think it was Dr. Phil that mentioned this. It was prediabetes. The reason why that's important is people that have prediabetes, you'll develop into full-blown diabetes in 15 to 30% of those cases within 5 years. Okay? How are diabetes and periodontal disease linked? We're talking about inflammation again. Dr. Basic was talking about inflammation as well. So inflammation in the body, what it does is it decreases your glycemic control. It decreases the ability of your body to deal with the sugars. Okay? So inflammation in the mouth, we have inflammation in the whole body. Now, this is the other thing I was talking about the whole 3-month thing. So studies will show the treatment of periodontal disease will lead to improvement in your glycemic control in people who are type 2 diabetics for at least 3 months. And what they're doing is they're measuring your A1C levels. Okay, again, that's where that 3-month interval is also coming from. Okay, so again, it's all based on scientific study. Does dental treatment change for people who are diabetic? So there are a few of you that put up your hand. You have a decreased ability to fight off infection in your body, whether it's in your mouth or anywhere else. You cannot fight it off as well. You're going to be more prone to gum disease, more prone to cavities. Okay? You need to floss. That's going to be more important. And then again, definitely the 3-month cleanings. Okay? And sometimes in certain cases we'll use fluoride as well just to make sure that, help prevent those cavities from forming. So, treating periodontal disease. I like to say that it's 30% clinical, 70% behavioral. 30% my job, 70% yours. We're not coming to your house every day to brush your teeth for you. Okay? So what we need to do is we do professional cleanings. Sometimes we'll have to put people through what we call soft tissue management. It's basically deep gum therapy, and that's actually what we did on that patient that we showed you earlier. Okay? So we've got this, that's where we started, and there's where they ended up. And then I gave her 2 new front teeth. And she looks the same. She's been in the practice for about 12 or 14 years now. She's still very stable. Okay? Now, one thing that always crosses people's minds is money, right? Because dentists are very expensive, right? So how much do we think, just to clean her up, how much do we think it's going to cost? Throw numbers out there. $5,000 to clean her up? I'm going to hire you. It costs about $600, $650 to clean her up. When we're talking about your health, it's not a huge investment. As long as you're dealing with people who are very skilled and very trained at what they're doing, it can be done and this is non-surgical, by the way. There's no surgery involved. You're not seeing a specialist. It's done in my office. Okay? Now, treatment for missing teeth. Typically with missing teeth, we have 4 options. Either you do nothing. Not a very good option, but technically it's an option. Then we have dentures, bridges, implants. So when we do nothing, the risk that we run is if we're missing the tooth above will grow down, the teeth on either side will all tip in, everything is going to start to collapse. Okay, what ends up happening is we end up having problems in the joint, in the muscles on the side where the collapse takes place. So we've got to put a tooth back in there to make sure that we keep it. If you've got a bunch of fence boards or a bunch of stones on the ground, you take out one in the middle, what happens? Everything falls in. Right? Same thing that happens in here. Okay? So, dentures, pretty popular option for a number of years. It is the most economical option. It's not the best option. You can only regain 30% of your chewing force with dentures. 30% compared to natural teeth. You'll only get 30% of your chewing force back. Okay? So we have full dentures if you're missing all your teeth, partial dentures if you're missing some. Now there's nice options out there for people that have no dentures where you can put some implants in, and the dentures can clip to the implants. It tends to hold much, much better. Next option is to do a bridge. So missing tooth in here, you can put a bridge in here. Very nice solution, it looks very good. Problem is you have to cut the teeth on either side. So what happens is you turn a one-tooth problem into a three-tooth problem. Because over time, you're putting extra pressure on these teeth and you risk fracturing those teeth. Okay? Best option you can go for, yes, it's the most expensive option, but you're getting the best thing that you can buy. Okay? Now we're talking implants. So we put a titanium implant in to replace the roots of teeth, and then we put the crowns on top. Okay? So at least you don't have to wear a denture. This patient was 55 years old, ended up separating from his wife, came to see me and said, I got to find a new girlfriend. I can't be taking my teeth out every night. Glad we can help. Same thing, younger patient, cracked tooth. You can tell the tooth is cracked because it's actually starting to fall down. Take the tooth out, put an implant in. Okay? It's a nice solution, very natural. It's not connected to the additional teeth. So, just to summarize, periodontitis has significant infectious and chronic inflammatory components. We've already talked about how inflammation is the causative agent of cardiovascular disease. It kicks off your atherosclerosis, decreases your insulin resistance. Everything is connected. Okay? You cannot have good general health unless you start with oral health. It is the gateway to the body. It's right in between your eyes and your heart. Don't ignore it. And I don't like that everybody's been picking on cats, so thank you. Okay, questions? Go ahead. Absolutely it does. Go ahead, you've got a question. Go ahead. Very common question. Mouthwash, it's not going to hurt you, but it's not going to provide you the benefits that the commercials will tell you. We've already heard about this. It's just, somebody's trying to sell a product. What's causing your inflammation and your infection is that plaque and tartar that's on your leftover on your teeth. Okay. Mouthwash is not going to get rid of it. You need something mechanical that's going to remove those things. Will it kill some of the bacteria that's there? Sure. But what's doing it is the alcohol content in the mouthwashes. And of course, the higher the alcohol content in the mouthwash, it will predispose you to developing cancer in the mouth. So you're better off brushing it. If you want to use it, we use Scope in our office. It's better than Listerine. Now there's Listerine Zero, which has no alcohol in it. Then the argument is, how much is it really helping you if they took it all out? You need a bit of a balance, so we have Scope in the office. Okay? Hang on, we got one here. Uh-oh.
Yes.
Hopefully I didn't offend you with my comment.
No. People do want to come and see their lawyer more than their dentist, but they don't expect to pay.
Yeah.
Dr. Gandhi, I'm 72 years old.
Yep.
I haven't had a dentist look in my mouth in 12 years.
Okay.
I'm a retired, self-employed lawyer with no dental coverage whatsoever. We live in this great province, and trust me, I live with an African refugee immigrant for 8 years. This is not about immigrants. Every Ontario Works person and every ODSP recipient in this province receives what people call gold-plated dental care. 6-month cleanings, they change the old fillings to the new fillings. I can't get a dentition. In Hamilton, where I came from here 6 months ago, Hamilton Public Health had a dental service for low-income people. Mm-hmm. And trust me, I'm a low-income person. CPP, OAS, and guaranteed income supplement. There isn't a way on this earth that I could afford to pay for dental care. It would be, they talk about pay my rent, or pay my hydro, eat, or pay my hydro. If I pay for dental care, I'm not going to eat. So, that's a political statement. We have 2 political parties already yapping on about providing dental care at what cost. That's another promise. It's going to go the way of the geese in the fall. Thank you. I try. Is there any service available within Durham or Clarington to assist low-income people like me? And some of your photos, I think, were taken in my mirror.
You're not alone.
Yeah, and if not, is there any way that, for example, Dr. Bragava, who's a new cardiologist for me, and thank you, that he could require, because I need health care, that he could require that I receive treatment that might be covered under the OHIP schedule. This is important to me. I have a high risk of death by cardiac arrest. No strokes in my family, but my father, my grandfather, my uncle all died around 60. I've outlived them by 12 years. How? Diet and exercise and lots of red wine. Having said all that, is there some solution that you may be able to offer those of us who are in this predicament?
I appreciate your question and your political statement. You know what? To be honest, it's a problem that a lot of people do have. You're not alone with that. Dentistry is very expensive. Unfortunately, the cost of materials, etc., tend to be very high. You know, overhead in this province for us runs at a ridiculous amount, and unfortunately, it just keeps going up. As far as solutions, the universities and colleges, Durham College, I'm one of the clinical instructors at the Hygiene College, they do offer dentistry at reduced rates. You know, obviously we've got students that are learning and students that are practicing, so sure, stuff takes longer, but at least there's an avenue available where we can get treatment done at a reduced rate. You know, other than that, it's always a tough question to talk about. We can spend more time talking about it afterwards, but all of us as professionals will do what we can to try to help people out within our professional guidelines. And when I say that, we're not allowed to offer discounts for people that don't have insurance versus people that do have insurance. It's actually insurance fraud, so it's not something we can do. Having said that, on a case-by-case basis, we always try to do what we can to help people out. We always try to treat people who are on ODSP or on other packages and whatnot just to try to do what we can to help people out. The best advice that I can give people is maintenance is a lot cheaper than just taking care of a problem when it arises. There was an article that was written in the Toronto Star a little while ago where they ballparked, if we're doing regular maintenance in a year, it's going to cost you $600 in a year. You know, not a terrible amount of money for over a 12-month period. But if we're avoiding dental treatment and we go every year, every 2 years, 12 years, that's when unfortunately more problems will develop because it's easier for us and it's cheaper to take care of it when we can find them faster. So the best advice that I can give is to go more frequently. It sounds counterintuitive, but at the end of the day, it'll be cheaper. If you're getting the oil changes done in your car, you're not going to blow your engine out because that's going to cost you a heck of a lot more than the oil changes do. But as far as services that are available, my suggestion would be, talk to a dentist individually to see if there's something that they can do to help out, or try to seek treatment at Durham College or at the universities because they do offer different programs.
Does offer dental services to low-income people even outside of Northumberland County.
Okay,
that.
I haven't heard of it personally.
It's in
but
Port Hope, I believe.
Okay.
Yeah, and
that's
I
great.
have a number, and if you look it up on the web, you have to submit a request. They won't give you a phone number or an appointment until you submitted a request and completed some income information.
Right, yeah.
Now, yeah, and I appreciate your observation. Yeah, maintenance, I'm a car guy. Maintenance saves a lot of big blow-ups. However, for me, it's too late.
Yeah,
it's never too late. The same as saving for retirement. It's too late.
Yeah, it's never too late. It's never too late.
You're very welcome. I have a question over here.
Okay, I'll get you after.
Does someone with prolapsed mitral valve need prophylactic antibiotics?
Not anymore. Not anymore. They changed the guideline. When did they change the guideline? That was 2007 they changed. So no, you don't need antibiotics anymore for that. Go ahead.
Speaking of implants, if you get one in the lower jaw in the back,
yep.
It's been mentioned that because of the nerve there, the danger could be that your lower lip could become stiff.
That's true. So I don't have any other x-rays to show. You're right. When you're placing an implant, you want the implant to be a certain length in order for it to be strong enough. But nowadays, we have 3D scans that we can put people through, so we'll know exactly where the nerve is, because the nerve may not be directly underneath. It may be a little bit on the outside, a little bit on the inside. So sometimes we can cheat with implant placement. The other thing is implants have gotten much better, and what I mean by that is the materials have become more biocompatible, and we can sometimes get away with shorter implants. There's also bone grafting that can be done, so more bone can be added on top of the nerve to give a little bit more space. Correct. On the upper jaw, the danger is the sinus, so sometimes the sinus has to be lifted up to give more room. But we have very good scans now that we can figure out, and we'll place the implants accordingly. Go ahead.
I have a very interesting question. I don't know, years ago when I was a child, they took out all my good teeth at the back, but I need a bridge. And so when the dentist was going to do the bridge and they did the x-ray, I guess because the teeth have been gone, like just there, it's buried underneath the gum, like really deep. So I went to, for a consultation, and they don't want to touch it because they said I could lose all the nerve, like I wouldn't be able to feel or taste. And I guess I wonder if a bridge could be built on top of that, because they can't remove it. I've had 2 opinions on it, and they said that it's risky.
Yep.
So I just wondered if it would be okay to put the bridge on it, or just, it's not causing me pain.
Yep.
It's just that when I bite down, it's just, there's nothing there.
So very difficult question for me to answer without having all the information, but we'll talk about a couple of generalities. One, it's the same here, that if the tooth is too down, or if an implant is going too far down, obviously there is a risk to the nerve. There's always any kind of risk with any kind of surgery that we're doing. In your situation, there's a lot of different things that could be done. I mean, if the tooth is healthy and it's down that far, you know what, I would probably tell you to leave it there and put an implant in if you're missing a tooth, because just leave that tooth alone then. Just leave it be. Because the more work you do on it, the more you cut it, the more likely it is it's going to get infected. So don't touch it. All the more reason why we talk about doing implants more than bridges. But it sounds like it's a very sort of specific situation. There's always a solution for any problem.
All right, last for real question over here.
Is there a difference or a preference over a root canal versus an implant?
Many people, one of those things when I talk to patients, they're like, what is your biggest fear going to the dentist? I don't want a root canal done. Like, have you ever had one done? Nope, but I know I just don't want one of those. It's always better to keep your own teeth, okay? So if doing a root canal, the tooth has to be evaluated properly. What's the long-term prognosis going to be if a root canal does get done? Is it going to be strong enough after the root canal is done? But the principle is keep everything you have, because no matter how good dentistry is and how good the materials are, nothing is as good as what you were born with. Okay, I'll be around for questions more afterwards, and I'll be in the back. Thank you very much.
Now, if I recall right, in his second or third slide, he mentioned about kissing. So, are we not supposed to kiss anymore? Because I'm already giving up steak after tonight. Okay. Just wanted to make sure. Again, another enlightening presentation. And, we talked about this from the start. It's information that is available to you to learn more about your own individual health care. Our next and final speaker, they always say we save the best to last, is Dr. Deepa Bhargava, currently an integrative medicine practitioner based in Ontario, Canada. She's a member of the American Association of Integrative Medicine and Canadian Integrative Medical Association. For 35 years, she's practiced as a head and neck surgeon in a university teaching hospital in Oman. She's been a lead researcher and has published over 60 research papers, including several books, chapters, and books. She's passionate and always believed in the philosophy of integrated medicine for the past 34 years, caring for thousands of patients by integrating surgery, medication, mind-body medicine, herbal medicine, along with other national solutions. Please join me in welcoming Dr. Deepa Bhargava.
Thank you. Okay. So I'm a bit new to this, headset and all, so I hope it works. Yeah. Now, people may be knowing about integrative medicine. This is basically a new kind of system where we integrate the modern mainstream medicine with some wisdom from the ancient practices and other forms of medicine. And this has been my passion. Now, the plan for the talk today is about intermittent fasting in heart health, so I'll try to stick to it. Although my passion is, again, a lot of herbs and spices, I've been always interested in plant-based, medication. It's been an ancient kind of legacy from India. We have Ayurveda. So when I had any health problems with my family or myself, that's where I would look for. And I had a lot of healing in my past with this form of medicine. So that's the reason why I like to integrate it with the mainstream. So we talk about, anyway, today we'll go back to our topic is about intermittent fasting, how to do it, and a little about herbs and spices. So what is intermittent fasting? See, first of all, just to make it clear, it's not a type of dieting. People think it's a form of a diet. It's not a diet at all. It's just a way of eating, and it's a way of life. In this, basically, if you look at the clock, we have an eating window and a fasting period. Now, who all fast in any form in this room? Any of you fast? Okay, no hands up, only one or two. But well, let me let you know, everyone fasts. When we sleep, we fast. So when we sleep for 8 hours or 6 hours, that period we are fasting. And today we'll talk about some science as well. So there's an eating window when you eat food and a fasting period when you fast. I hope this is a bit clear. Now, this is a picture which, let's see about the mainstream medicine. Now, in acute medicine, it has been very successful, miraculous, like you see people get, when you talk about the acute treatment for the acute problems in medicine, it has done wonders and it's very successful. But when it comes to chronic diseases like diabetes, obesity, hypertension, heart conditions, if you see the picture, you can see that, we have there are two doctors here. I don't know how clear this cartoon is. And there's a sink which is overflowing. So what the doctors are basically doing, it represents, they're just cleaning the floor. And what is feeding in this sink? It's basically all this. We all enjoy this. But anyway, this is what is coming through, and the doctors are working here. So this is the state of medicine, the state of the world, in fact. And you can see that obesity, they say 68% of the world's population is overweight. And diabetes is so alarmingly, it's increasing like anything. So now let's come to a Nobel Prize winner. This is Mr. Yoshihori Oshimi. He's a Japanese scientist who was awarded the 2016 Nobel Prize for his discovery on autophagy. Little go into the science. Now, what is autophagy? Now, autophagy is a system inside the cell. Every cell of our body has its own intelligent way of healing. So what it does, if there is, like any toxic thing inside the cell, it takes the cell and it goes and it breaks it up, all the toxic things, and it recycles it. And it's just like you take your car for servicing, you take your car to a mechanic, he cleans it up, removes the rust, and makes the engine working better. So each and every cell of our body has got the capacity to heal by itself, and this is autophagy. So this science is like Nobel, and it's quite a breakthrough. Now, what triggers autophagy? What triggers the cell to, it's basically the cell eats itself. You must have heard of cases where people's cancer has gone off by itself. It's miraculously vanished. So it's basically the autophagy, which has, it's a procedure by which the cell completely eats the cell up and it can heal. So autophagy is triggered by fasting. So when there's a lack of nutrients, it has been seen that the cell recycles its diseased and toxic things and produces, in fact, new things. So it's very recent. This is all very recent science, and it'll be some time. So how many of you would believe in what the father of modern medicine, Hippocrates, said sometime? Would you believe that? Yeah, okay. Food is thy medicine, and believe me, food is thy medicine. It's very, very important. People have been, medical sciences has neglected nutrition, and it's one of the really neglected fields. Doctors are very much ignorant, including me, and most of them, they know nothing of nutrition. And it's very unfortunate because they themselves, the medical people, are suffering because of lack of information on nutrition. And it's politically, there's a lot of politics as well in the information about nutrition. Coming to the history of fasting. Now, everyone would know, like animals in the wild, by nature, if an animal is sick, anyone has a pet, you see, they just stop eating. So when they stop eating, they heal themselves. Similarly, if you look at the history of mankind, there were the hunter-gatherers. What were the hunter-gatherers? The man would go out in the wild and he would pick up some berries and hunt some animals, bring them home, eat. And sometimes they would just not get anything. It's a very difficult job to go and hunt. So they would not get, so it would be like fasting and feasting. When they go and they get the animal, they feast well, and then the rest of the time they fast. And what is interesting, when you fast, the muscles tend to grow. And so if they don't get food, the hunters will get more stronger, the muscles mass will increase, and so they have more power to go and hunt and get some animals for their food. So the hunter-gatherers and all the ancient civilizations, whether it is the Greeks, that is Plato, Aristotle, all the Greek philosophers, they all believed in fasting. In fact, Plato, I was reading, he used to recruit his followers, and all his followers, he would tell them that you have to go and tell people to fast and eat a plant-based diet. He was a big proponent of plant-based diet, which Dr. Phil was talking about earlier. But anyway, all of them fasting. Now, in fact, even if you look at in the Bible, it's said 40 times in Bible, the word fasting comes in. Like you have the Lent, period, they fast. If you see the Muslims, they fast during Ramzan. In fact, if someone doesn't fast in Ramzan, they are said to be sent out of the faith of Islam. Their level of fasting is pretty high because they say that first level of fasting is to abstain from food for that period. And the better people, the elite, they're said to refrain from thoughts. They should not get ill thoughts. They should be pure in their thoughts. They should fast from thoughts. And they say it's quite an advanced system of fasting. Now, in India, most of the Indians who have lived in India, it's a big thing in our culture, fasting. But unfortunately, we are losing it, as we are passing on and getting modern. We are losing the modern lifestyle. Now, the modern lifestyle is food everywhere. We have all delicious food coming from everywhere, and that's leading to insulin resistance, and which has led to the whole world, like 48%, being obese, and diabetes is really galloping at a very alarming rate. So, now what does Ayurveda recommend? Basically, they recommend a plant-based diet. I won't go into detail. These are all plants and grains, little grains, and some nuts and seeds. So, we are just going to talk about, so I'll show a small film about insulin resistance. Now, who needs intermittent fasting? Like many people would say we don't need intermittent fasting. So basically anybody who has got insulin resistance, like people who feel hungry once they eat, if you've noticed that you feel more hungry after eating, those people, they would benefit from intermittent fasting. And so not everyone. So, okay, that film didn't run, I don't know. Okay. How do I... messed up the whole thing. So,
okay. So it's before, okay.
It's good we have nice technical people here. This is one. Yeah.
No, that.
This one.
So this is the video. Which one? The blue one. The blue one's
Blue one.
Okay, so somehow I thought if she clicks on this, where is the video?
The video, if you press it.
Double click. Okay.
Type 2 diabetes is a metabolic disorder that causes sugar in the form of glucose to accumulate in the blood rather than being used as fuel by the cells in our body.
I'm going to start it again. When
we eat, food is broken down by our digestive. System into nutrient molecules that are then absorbed through our digestive tract for use.
Hold on. How do you start it again?
You can start from here, actually, doesn't matter.
Type 2 diabetes is a metabolic disorder that causes sugar in the form of glucose to accumulate in the blood rather than being used as fuel by the cells in our body. When we eat, food is broken down by our digestive system into nutrient molecules that are then absorbed through our digestive tract for use by the body. Foods containing carbohydrates or various sugars are broken down into glucose. Glucose is an important source of fuel for many organs in our body. However, to be able to use the glucose for fuel, the glucose molecule must first enter into the cell. The pancreas produces a hormone called insulin, a chemical messenger essential for the entry of glucose into cells. As the blood glucose levels rise after a meal, insulin is released into the bloodstream and sets processes in motion to trigger the removal of glucose from the blood to enter into the cells. In type 2 diabetes, the cells become resistant to insulin and ignore its message to absorb glucose. This is known as insulin resistance. In addition, in type 2 diabetes, the pancreas is unable to produce the greater amounts of insulin needed to trigger these resistant cells to take in glucose from the bloodstream.
Now, if anyone has a medical condition, then it's not advisable, especially if you're diabetic. One should go very slow with starting the. And so, anybody with insulin resistance, which many people would have, fasting will help them. And there are a lot of benefits. As I have shown about the Nobel Prize, he was given the Nobel Prize for this discovery. So basically, there's a lot of healing which can happen with insulin. With the fasting, and that's in all the organs, whether it's the heart, the brain, the muscles, and hormones, because it balances. Now, there's a certain class of people who should not fast, and fasting is not recommended for pregnant mothers, anyone who's below 18, breastfeeding, people with eating disorders like anorexia and all, they don't do well on fasting. Very important is adrenal issues. Like a lot of females, they have a lot of adrenal issues. So they may not do well on fasting. And for diabetics, they can fast. And pre-diabetics, definitely that is one group which was going to benefit by the intermittent fasting. And so, but if someone wants to fast and the rest of the time they're going to be eating all this stuff, then I don't think it's going to help them. Fasting has to be combined with a kind of a good nutritional plan where you go for more of a plant-based, or even if you're eating some meat and all, but everything has to be in moderation and it has to be sensible. So when you combine that with fasting, then one can expect good health outcomes. What are the types of fast? Now, initially, if anyone wants to start, it's just a simple fast. 12 hours, you eat for 12 hours, and that is your your eating window, and 12 hours is your resting window when you don't eat at all. You just don't, you abstain from anything which has calories. Yeah, you can have teas with no calories, that is your black tea with no sugar and no milk. That you can have during the fast. I'll talk about the herbs which can support the fasting period. There's cyclical fast, that is 16 hours of fasting 2 times a week. Then there's a strong fast where you do 16 or 18 hours fast, that is you eat in a shorter window of time, and that way one can slowly, step by step, proceed to a state where they only fast they eat 1 meal in a day, that's a 24-hour fast. But for that, one has to gradually, step by step, increase the fasting window. Now, so these are the details about the fasting. I don't think our time will permit us to go into the detail. But now getting prepared. So when you do the fast, water, you can drink plenty of water, and even flavored water is said to be very good, where you throw in some apple or you put in some lime and have flavored water. That's excellent. It helps. Some people can have coffee, but still it's better not to have more than a cup of coffee or so in a day because it has high caffeine. And caffeine has got it also worsens the insulin resistance. So it's nice to have a good night's sleep, because the more you sleep has shown to improve the insulin resistance. There's a lot of relationship between sleep and insulin resistance. So sleeping is very, very important. As important as your diet is the sleeping. And you have to prepare yourself psychologically and keep yourself busy during the fast. Start with small fasts, and at the first sign of hunger, one must not rush to eat food, better to drink water. Many times the body may be dehydrated and it's craving water, but one goes to food. And think of the health benefit which you can get. This is a picture actually from Queenstown, which I was there last month exactly. Queenstown in New Zealand, I was there a month back. And this is supposed to be one of the real beautiful places, so I said, let me break the talk if it's getting boring for everyone. Now, coming to the heart benefits, the protective benefits of intermittent fasting. Now, research has shown, research is not very high level in the sense there have not been too many studies. It's mostly animal-based studies and a few studies on humans. That's why don't expect your doctor to recommend intermittent fasting to you when you visit them, or they may not be knowing about it themselves, because this is very early in the, we are very early with all this information. So heart protective effects it has shown by research in the lab animals, especially that intermittent fasting, reduces the infarct size. Because of autophagy, it remodels the infarct. So where there's a heart attack, there's a death of the tissue in the heart. So this dead tissue, by autophagy, is quickly cleared off. And that has been shown to be helpful in the animal model. And it increases the vessel growth. It improves the heart hypertrophy. Like if there's a heart failure, intermittent fasting is shown to improve it. And now with the cholesterol also, the study has shown that it improves they have done a lot of studies in countries where people fast during the Ramadan and all. So most of the studies have shown that it improves the high density lipoprotein, that is the good cholesterol, and it reduces the bad cholesterol, it reduces the triglycerides, and it's known to improve the abdominal obesity. Now coming to research, actually research is nowadays become quite politically, and a lot of vested interests are there. There are lots and lots of things in it. So by the time, this is all basic research with a few studies, not very high quality, but it's harmless. Fasting is harmless for people, so it's a good idea to fast, and it may help many people. So, okay. Now, also fasting has shown to improve the hormone profile. Now, insulin, you can imagine that if someone spikes insulin, as you've seen, that every time you eat, the insulin goes up. Insulin goes up, and then it makes you more hungry, and then it keeps on. So whole day, when you keep on eating, your insulin is going up and down. But if you don't eat, the insulin is stabilized. So people with prediabetes, you can imagine, makes logical sense that if you just don't abstain from eating, you keep your insulin flat, you'll be much more comfortable, and it's good for the body, the heart, the brain, the hormones, and even fasting it's taken up. In fact, the fitness industry has adopted intermittent fasting like mad. All these bodybuilders, if you see people with all the muscles and all, they have adopted intermittent fasting a lot because the benefit is it grows more muscle. The growth hormone, they say after 24 hours of fasting, your growth hormone increases by, they say about, I think 50 to 50% or so. So and if more you fast, the 48 hours, it goes up by 70%. So when you have more growth hormone, your muscles get the message to increase in size. So that's how these fitness industry people and the sportsmen and all, lot of sportsmen, they do this intermittent fasting to build up more muscle in their body. And there are some adipokines. Now, these are very toxic chemicals which are secreted by the abdominal fat specifically. So these also have shown in labs to help. Now, actually, this is one of our books I had published some time back on herbs and spices. So if anyone wants to know how to support the intermittent fasting, that is basically the fasting phase when you have, so there's some, has everyone received a handout which I have given you? So at the back of it, the handout is there, and anyone wants more, you can collect some more handouts. So there's some tea recipes, which can help when you're fasting. I would like you all to try those tea, especially the turmeric tea. Turmeric is one of the spices which has shown there are about 13, 14 very good studies which have shown the benefit of turmeric, especially for the brain health, for the joint health, for the bone health, heart health, the sugar, insulin. So there's a turmeric recipe which I would like you all to try it out and enjoy some time, a turmeric latte. And in fact, if you go to these boutiques these days, I went to a very sophisticated boutiques, in New Zealand, in Queenstown when I was, and they were serving this turmeric latte, and I was happy to have it there. So all the health spas and all, when you go, they all are, prescribing those teas. So you can enjoy it. And a little bit about my book, because I've just published a book on intermittent fasting with herbs and spices. And this book is for a free download. I have especially for this event, and since it's just been launched, so I've kept it free for few days, I think till the 9th, it's on a free download because then it will cost more. So it's a print version as well as an ebook version is available of the book, and this has a lot of details, and if you want to incorporate herbs and spices into your life, go into a more healthy style of living, and of course we personally recommend again a plant-based diet, but with balance. I know it's very, very difficult. People love their meat, people love their cheese, but a step in a good direction. We all are trying to improve our health. So you can see this book. So here is the thing. And we have a workshop as well on the 20th if anyone is interested more on learning more on this subject and learning how to do the intermittent fasting and how to incorporate the herbs and spices. And so you can join on the 20th of May. We have the workshop at Heart Care. The pamphlet has the phone number and email to contact. So that's it. This is another picture taken in Queenstown. This is where we were staying, and the small island is where Oprah Winfrey's, I don't know whether you saw the latest movie, so it was filmed over there. So yeah, I don't know. Yep. Thank you, everyone. Any questions? Yeah.
I'm afraid I have to rebut some of your arguments here because Donald Trump is the healthiest president ever. A diet of burgers, fries, and milkshakes. How do you explain that?
Okay. Now it comes to the genes.
Can you repeat the question?
Yeah.
Donald Trump, I said I'm afraid I have to rebut some of your arguments here because Donald Trump is the healthiest president in history and a diet of burgers, fries, and milkshakes.
Okay. Well, I don't know, do you have Netflix at home?
Yeah.
Okay, in Netflix, there are 3 movies in which I would like you to watch them, And in those movies, they talk about how the fast food industry has they have held the American president's throat in their hand. In the sense, they are the biggest people who support. You think Donald Trump doesn't have the access like common people like us to the best physical trainers, the best dietitians, the best cooks, everything. He eats animal. He's very fond of his steak, I know that. But besides that, they have access to a lot of things which common people don't have. They have the physical trainers, they have a nutritionist, they have even all the celebrities and all. And secondly, I can only explain it in one way. He has very strong genes, and his genes are very strong. He has a very strong autophagy mechanism that he can eat, put in anything, and it comes out, and so he can heal. But a lot of science would be so.
All right, I have another question back here.
And he has the best girlfriends and women also, so, something he must be doing which we don't know about, Don't believe what you read.
All right, we have a question back here.
I'm just wondering whether eating frequent small meals throughout the day would keep your insulin stable just the same.
This is an excellent question. Now, when it comes to intermittent fasting, let me tell you my own experience. I started with intermittent fasting because, as you see, I've been struggling with maintaining my weight. It didn't work for me. I'm being honest about it. But eating small meals is, especially for women, I believe it's very, very important because of the cortisol level and the hormones that we have been disadvantages. In my book, there's more details on it, that for women, intermittent fasting in the daytime and long fasts probably don't work. So frequent small meals, but once you stop eating, that's about 6 or 7 o'clock, you stop eating, try to go for a 12 to 14 hour, especially people with adrenal issues, with cortisol issues, people with other problems, they don't do so well on intermittent. So you can fast with small frequent meals during the daytime, but stop in the evening and 12 hours, because that's the science. I've presented basically the science. There was actually 2 slides with references which I had shown to my husband last night. He said, "Oh, remove this. Nobody was interested in your references," because I had referenced most of the statements which I had made with all the references, but they were removed because we felt it will overwhelm the audience. So, yeah. So he was joking. He said, "Ask them, but did they miss your references?" So I said, but small frequent meals may work for some people.
I find that intermittent fasting, I don't do intermittent fasting, but I eat that 1 meal a day. But what I do, and it works for me, is bone broth. Whether chicken, fish, or what have you, that keeps me satisfied. During the course of the day, I also do vegetable juices, which I juice quite a few times a day, and that works for me. So I'm not hungry, I lose the weight, and I maintain what I have.
Excellent. That's very nice. Bone broth is good. In fact, there's a recipe of with herbs and spices. So I would urge you to try that out, the bone broth recipe and the pamphlet which I've given out to you.
I think one of your slides you had the term fat adaptation. Can you explain what that means?
Okay. I think I skipped that because I was kind of running low on time. Fat adaptation. What happens when anybody diets? Any kind of diet, whether you go on the Atkins or ketogenic or any of the popular diets. In the beginning, you lose is the water weight, and people think they've lost a lot of weight. And then suddenly the weight loss stops. The body just goes into a kind of refusal to lose more weight. And then slowly, with the mechanism of autophagy and all, the fat starts releasing, and your body gets used to utilizing the fat from the cells, comes out. And then that is the goal when you're into the weight loss. So you get fat adapted means you start using fat for energy. Your own body stored fat for energy. Now that is one of the goals when one is trying to lose weight, is to reach a stage where nobody wants the extra fat we have in our body. But it's difficult to reach that state because what happens, people first lose water, they lose a lot of weight, then they get disheartened, they plateau, and the fat is very resistant. But there's a state when the fat starts getting metabolized, your body starts, and that's where this fasting helps, and it helps in getting the fat out, and you start using your fat for energy. So that is fat adapted. Then you said person is fat adapted, when you're utilizing your fat for the energy.
Okay, we have one last question, I think, over here.
Is there any special recommendations for menopausal women?
Yeah, again, menopausal women, I said nature has been very unfair to, we women folk for everything, the hormones and all. So especially menopausal women, some may not do well on intermittent fasting. And what usually the literature has shown that women initially when they start doing intermittent fasting, they should not go beyond 18 hours of fast, and their some of them would really do well if they have a window of eating with small frequent meals, because they need that. Otherwise, the hormones just go crazy and their mood swings and all that. But as they progress slowly and gradually, they build up more muscles. There has been there are a lot of cases where people have completely transformed their bodies, from what they are and what they end up being, as the muscle goes more, the body gets fat adapted. As the system, autophagy increases, you can imagine every cell is recycling itself, going overboard. So there have been a lot of, so that's a recommendation for women, to go very slow, start with small meals, and gradually with the increasing exercise, increasing the muscle mass, then you proceed to the longer phases. Because, also intermittent fasting is very interesting, even for the Alzheimer's and all, it is shown to help. So for the long run.
Muscle wasting. Because when you fast, your muscle tends to diminish. You tend to lose muscle. But I find the bone broth helped me build the muscle.
Yeah, exactly. Yeah, bone broth is slightly with the purist, with the fasting, they don't agree on bone broth. I personally think bone broth is very good because it has the amino acids to help the muscles build up.
And one final statement as well, I found with my clients as well, the gradual meals works as long as you have the appropriate bottom line caloric intake. So a lot of women are not eating enough. So when they take those small meals, the sum total of those meals, they will store weight if they're not getting enough caloric intake. So just make sure if you're going to do the small meals that the sum total at the end of the day, you're getting enough not to store.
Exactly. It should not go overboard. Yeah, that's right. Portion control is very, very important.
Okay, we'll call Fred back up to the stage. Thank you very much.
Well, it took us 5 hours before Donald Trump's name came into today's session. You notice that? The cheeseburger delight man. Anyways. I'd like to take this opportunity on behalf of everyone here to thank all of our today's speakers for donating their time to educate our community. I'd also like to thank all those here at Faith United Church who have been instrumental in ensuring that everything ran smoothly. To all our volunteers from Faith United Church and healthcare, we thank you for the hard work and dedication to our cause. And last but not least, thanks to everyone here today who came out to learn and support this event. This day would not be possible without you. And make sure that if you're not on the email list, you sign the list before you go. And I have to tell you, your questions were unbelievable, and it makes the speakers feel even more welcomed here when you ask those type of questions. I know that healthcare would welcome any feedback you may have and hope you to do this again next year. Again, on behalf of everybody, thanks again. Enjoy the rest of your day. And strike up the barbecue. Oh, no, I'm not supposed to say that.
One more announcement. If you want to relive this presentation, it's live on faithunited.ca under sermons.
And I did have that as my note, and I apologize.
Last time I visited, I asked him a question. I said, I drink 2 beers